Good afternoon again, Bermuda, and welcome. Apologies for the technical issue. We are now back up and running. Now hand it back over to Minister Wilson. Minister, you may begin.
Okay, thank you. Good afternoon again, everyone. Since the last update, as was reported, the Ministry of Health received 4,124 test results, and 31 were positive for the coronavirus, giving us a test positivity rate of 0.8%. Of the 47 active cases where typing is available, 34% or 16 are Delta and 60% or 31 are Omicron. We have a total of 62 active cases. While we continue to have the Delta variant, the Omicron variant is dominant and the number of positive cases has doubled since Monday. Because this variant is highly transmissible, we anticipate that the numbers of positive cases of the Omicron variant will increase significantly and quickly. So far, the outbreak settings are in schools and the workplace. The positive cases are asymptomatic, though their symptoms are mild. These symptoms include cold-like symptoms, fatigue, runny nose, cough, headache, congestion, sore or scratchy throat, and body aches. If you have these symptoms, stay home, even if you do not think that you're sick, because it is better to be safe than sorry. Most of the cases that we are currently seeing are in vaccinated individuals. These are mainly recent travelers who, by and large margin, are vaccinated, so we expect only the mild symptoms that we are seeing. Unfortunately, our experience with the Delta wave is that unvaccinated people are particularly susceptible to infection, and in significantly greater numbers, they ended up in hospital, and sadly, many died. We anticipate a rapid spread of the Omicron variant. However, we must collectively do everything we can to avoid mass community transmission. Do not let your guards down. Do not stop being cautious. And now is the time for you to take extra cautions and precautions. What really concerns me is that we have a high number of people in the community that are sick from the Omicron variant. We may find the number of people in hospital higher than what we did have during the Delta surge. A surge in cases would significantly impact schools, businesses, and most importantly, it could overwhelm our healthcare system. Caution must be taken at high-risk settings such as bars, clubs, restaurants, hotels, large gatherings, and Christmas parties. We must take precautions and stick to the basics. Wear your mask properly, good hand hygiene, and keep physical distancing from those not in your household. We know people will be out and about this holiday with family and friends, and so here are some tips to keep in mind to stay safe. Prioritize your outings and do not try to go to everything. Try to minimize mixing households. Take an antigen test before you go out so that you know your status. A home test is a quick and easy way to find out whether or not you are infectious. So I want you to adopt the habit, know before you go. Antigen tests are readily available throughout the community, and we suggest that you take an antigen test before attending any gatherings, particularly where there may be vulnerable persons that are present, so that you can know your status before you attend. Parents and guardians, please ensure that your children attend approved registered camps over the holiday. Government-approved camps are assessed for COVID-19 compliance by public health professionals, and any unapproved camps risk closure. Both participants and camp counselors must know and follow the public health safety measures to reduce their exposure to the virus, and our camps must keep their groups small to decrease the opportunity for the virus to spread. Just as with workplaces, do not send your child to camp if he or she is showing any symptoms of COVID-19. The government website has a list of all of our approved camps, and it's updated weekly. Camp operators should review the camp guidance at www.gov.bm/camp guidance. And as a reminder, all public spaces must have hand sanitizer available for patrons and maintain accurate contact tracing records. This includes all businesses, restaurants, bars, gyms, beauty salons, and workplaces. Contact tracing is an essential part of controlling outbreaks and stopping further spread. In addition to presenting a valid safety key for verification, patrons must provide accurate contact tracing information, and that includes full name, phone number, home address, email address, date and time of arrival. And I encourage all unvaccinated people to get vaccinated. Along with following all of the public health guidance, the vaccine against COVID-19 is one of the single most important measures to keep our communities safe. Do the research, talk to your doctor, and make an informed decision about getting the COVID-19 vaccine. There's a wealth of information about the vaccines online at gov.bm. And for those vaccinated people who are eligible, please get your booster. Given the mutations that are associated with Omicron and the passage of time, which can impact the efficacy of the vaccine, as of the 15th of January 22, all vaccinated persons will require a booster in order to receive a renewed safe key. You are eligible for a booster if your second jab was more than 6 months ago. Most, if not all, of the vaccine appointments leading up to Christmas are full now, but we are looking to restart vaccinations as early in the new year as possible. The Omicron variant is spreading quickly, and now is not the time to let your guard down. Now is the time to be extra cautious. Our health and safety depends on personal responsibility. Each of us has a role to play in stopping the spread. Continue to wear your mask indoors and outdoors if you cannot physically distance. Practice good hand hygiene, maintain physical distancing, and download the We Health Bermuda app. Stay safe, Bermuda.
Thank you very much, Minister. At this time, we will begin the question and answer period, starting with Gary Foster Skelton. Good afternoon, Gary.
Good afternoon.
And you may begin your questions.
Thank you very much. So, thank you, ministers. My first question, are you going to make any changes to limits on gatherings or parties over Christmas due to the risk posed by Omicron? I know you're saying recommending people voluntarily test before going out, but will you be making any kind of changes to restrictions?
Well, Gary, in addition to what we're recommending, we're also recommending that people maintain the public health measures that we've been operating under for the last 2 years. The Cabinet Subcommittee, COVID Subcommittee, meets regularly. In fact, we will be meeting on Monday to review the scenario, the situation, and to see whether or not further recommendations with respect to public health amendments will be considered.
Thank you. Now, in the UK, infections are doubling every 2 to 3 days or faster with Omicron. The results, the Bermuda results received yesterday are from tests that were done on Monday or at the latest Tuesday. So we are several days behind a true picture. Will government increase the frequency of updates while we navigate the current rise in infections?
We will continue to provide information to the public either by this type of medium or alternatively through our regular press releases. I think it's important to note that we're not lagging behind with respect to the reporting of the results, but once we receive the results, there are steps that have to take place first before we actually make that public, such as contacting the individual. So we've always had reported our results 2 days afterwards to ensure that we have sufficient time for those persons and the doctors to contact any positive cases. But we, as have done for the last 20 months, will continue to keep members of the public appraised every step of the way with respect to latest developments, amendments to any of the regulations, any potential rollbacks, and where we are in particular as it relates to our numbers and our positivity rate.
Now, even if Omicron appears to produce less severe disease, if it's half as virulent as Delta but twice as contagious, it's just as much of a risk by the sheer number of people it could infect, especially since it seems to bypass some vaccine immunity. How prepared is government and our healthcare system for a fifth wave of coronavirus infections?
Well, I think, Gary, there's a couple points that are really, really important that will show that we are doing what we can for preparation. First and foremost is our border controls. You would note that we test everyone that arrives in Bermuda with a PCR test. That is the gold standard test, so that if a person is arriving to Bermuda, they are required by law to have a PCR test. You'll also note, with respect to our border controls, persons that are visiting Bermuda that have arrived in Bermuda have other PCR test requirements during various days during their length of stay. You also would note that we have implemented a requirement that all visitors that arrive in Bermuda must be immunized unless they are under 18 years of old, and that would have just been in the latest public health amendments. So I think with respect to the border controls, we are certainly doing all that we can to best mitigate the impact and the arrival of any of the variants or of Omicron or Delta or any of the other COVID variants. In addition to that, again, we continuously remind persons that we have to take personal responsibility, Gary. This is something that all of us are impacted. And if we continue to take personal responsibility, if we're going out socializing throughout the holiday, make sure that you try as best as possible to minimize the mixing of bubbles. Antigen tests are available everywhere throughout the island. So we're trying to encourage people to live by the mantra, know before you go. Take an antigen test before you go to any particular event so that you know what your status is when you're walking into the event. You'll probably be happier in knowing that you at least know your status before you enter into a crowded room.
Minister, if I may.
Yeah.
Yeah. Hi, Gary. Just to build up on what the minister said, we've had extensive after-action review and debrief following the fourth wave, the wave with Delta, and learned some of the lessons of some of the things we did very well, and on some of the things that could have been improved in our response to that outbreak. And we're definitely bringing all of that learning into bear going forward into what we expect might be an uptick in cases soon. In particular, we have spoken to all the health teams about what's going on, and we've asked them to review and go through their business continuity plans to make sure that they're ready to be able to deal with this, and gone ahead to mobilize staff who may have been redeployed following the end of the last wave. So it's things are in progress, but as you yourself know, there's still quite a bit of unknowns around how this virus is going to develop. And so there's always going to be that aspect of watchful waiting to make sure that we're able to respond quite nimbly if once we get a clearer picture of how this outbreak would develop.
Okay, well, staying with you, Chief Medical Officer, the hospital saw several weeks of sustained COVID admissions during our fourth wave, and we more than tripled our COVID-related death toll. Following that, has the hospital expanded its COVID treatment program at all? Monoclonals, other drugs, medicines, have you stocked up in case you face another influx of patients?
Oh, well, I am in, while this question should be directed at the hospital, I am in constant communications with the executive of the hospital, and I know that they are really well prepared, and basically all the stock that has been used up during the last wave, they have gone ahead to increase their oxygen capacity, increase their PPE capacity, make good on what was used. Staffing remains a challenge because it's difficult to get skilled staff on island, and you and I know that once we have huge outbreaks on the island and people have to quarantine, then it disproportionately affects the hospital. But they are doing a brilliant job of preparing for this. In addition to this, we now have antivirals that wasn't available when we had the fourth wave. So that's another tool in our toolbox to be able to fight this. And my colleagues in the hospital will be able to give you more details, but I know that they're doing a very good job of preparing for any uptick in cases.
So there are additional drugs that we have for
Correct.
treatment of patients rather
That's
than
correct.
the preventative measures, but actual treatment. Yeah. Okay, I'll look forward to being able to speak to the hospital about that. One major concern that you have just touched on is the impact if there's a large wave of COVID. Talking about the UK, according to the UK's Chief Medical Officer, hospital staff being infected and isolated could result in, quote, reduction in supply and increase in demand in the health service over a very short time, end quote. Knowing that our hospital is also concerned about this and how it could it could see a reduction in resources, not just for COVID care, but for cancer care, diabetes care, stroke care. What mitigation measures are you taking to protect our health resources?
Okay, so the key thing that we're doing is basically to make sure that all our healthcare providers are vaccinated, and there are not just vaccinated, those who are eligible are given the booster shots, and that increases the protection. It allows us to be able to have enough people working to be able to take care of all of us. Remember, when we have COVID, heart attacks doesn't stop, strokes don't stop, road traffic accidents still happen. So we need to keep all our staff as healthy and as possible. In addition to that, I've already talked about PPE, and we're making sure that all our staff have the appropriate personal protective equipment to be able to do the job that we so desperately need. We're also providing for our healthcare workers psychological support as well, in addition to the physical support that we need. It is hard to watch so many deaths and so much suffering. They all need psychological support as well. So those are things that we're doing. This is in addition to the regular screening program that we put in place to be able to identify people early who are ill and take them away from patient-facing duties. If we need to pivot them to non-patient duties while they are isolating, then that's fine. But that's part of the things that we're doing.
Gary, this is your final question.
Thank you. Perhaps you could expand on that a little in this next question, because one thing we're learning about the Omicron variant is that it appears to be infecting people who are vaccinated as more. Like I think we've got 30% protection against infection, even though you're less likely to get sick. So it's not just the resource risk at the healthcare level. Widespread infections and isolations could potentially impact staffing for public services, grocery stores, docks, the police service. If there were widespread infections, might you allow key staff in certain industries to work with asymptomatic or even mild COVID?
Okay, so yeah, you're right. And depends on the study that you're looking at. This is pretty much early days in this with this Omicron variant, but it could be reduction in protection from infection could be as low as 30 to 40%, or in some cases, quote, 50 to 60%. However, if once people have had their booster vaccination, your protection level increases up to about 80%. So that is one of the key things that we can do to make sure that people are protected from this. Going back to your question about is there a possibility of us allowing people to work if they've tested positive, or if they're contacts of people who've tested positive. So we have had for a while now a workplace quarantine process. And there are certain criteria that people need to meet before they're able to qualify for workplace quarantine. And
Is that
basically,
even with a positive case?
no, this is for contacts
For
of
contacts?
positive. Yes,
Right.
contacts of positive case, not for the positive cases.
And that would be the question if some
So if we have
asymptomatic or mild.
positive cases, they possibly could work remotely. If their work can be done remotely at home on a computer, then that's fine. But if they have to have contact with other people, then that we would not be encouraging positive cases
Minister,
to
I
have
have to
further
call you right
contact.
back. I'm on a press room.
Would not be encouraging positive people to have contact with others. However, their contacts, if they remain asymptomatic, if they remain and they're fully vaccinated, we, depending on the risk assessment, can allow them to have a workplace quarantine.
Okay. Thank you, Chief Medical Officer.
All right, thank you very much, Gary, and
you.
enjoy the rest of your day. Now I'm going to be bringing on Jonathan Bao from the Royal Gazette.
Afternoon, everyone. Can you see?
Good afternoon, Jonathan. Yep, we can see and hear you. You're live, and you may start your questions.
Thank you very much, Michael, and thanks for having us. We're back here again. Folks, I would like to start with the vaccination clinics. Forgive me if I misheard. I was under the it sounded like it's going to be stopping over Christmas. I was wondering why we're having that break in it. Can you speak as well to the number of vaccines that we have left? If we want to get those jabs out there, why are we stopping over Christmas? Or did I mishear?
We're just stopping temporarily over Christmas. Jonathan, you can appreciate that the team also require a well-deserved break. They've been working very, very hard for the last 20 months. So we're only just taking a temporary break so that people can become renewed and refreshed and ready to fight this battle in early January. So in early January, we'll make an announcement and we will go ahead and recommence the vaccine clinics. It's just a temporary break so that people can get a little bit of well-deserved rest.
I got you. Are you able to speak to the number of vaccines that we have in stock at the moment?
I don't know. I don't know if CMO, if you have them. I know that we're expecting more supplies in early January, but we have quite sufficient supplies. I've indicated previously the United Kingdom has supplied us with quite a large degree of vaccines, and they continue to reassure us that they will continue to provide us with vaccines based on our needs and demands.
So it's basically your folks need a break and they're getting a break over Christmas.
Yeah,
Absolutely.
Okay, got you. I wanted to clear up something to do with, I heard mention of the booster and safe key. I was taking notes while you're speaking. I mean, does that apply? Where are people who had their second jab less than 6 months ago with that safe key situation and getting the booster? Are they still okay, or
I'll talk about the safety part, and then the efficacy, I'll leave that to CMO. But what I was referring to is, remember, you cannot get your booster until 6 months is expired past your second dose. So what we're saying is individuals that have reached that 6 month point, we are encouraging them to go and get the booster shot. And that when we start administering safe keys for January, if you are vaccinated, vaccination, in essence, immunization will in essence be a booster. So you'll need 3 shots.
So that will be for people who are eligible at that point in time. It's not for everybody. So if you're not yet eligible for a booster, you will still get your safe key as per usual. But if you're eligible and you have had your safe key, I've had your booster, you get your safe key. But if you haven't had your booster, then you will not be eligible for a safe key.
I got you. All right. I wanted to clear that one up. All right. Thanks. Moving on. All right. So Minister, I hear you on the personal responsibility and people getting the antigen test before going out. Well, we have seen in the past that people haven't some people haven't necessarily abided by the personal responsibility. Isn't the government not showing caution at a time you're telling us to obviously be cautious? We're in the middle of, or looking like we're having an outbreak happening, but obviously no one wants restrictions, but is this the time to be leaving it to us to be responsible?
Well, I mean, Jonathan, we've been at this for 20 months and we've maintained that, we have to get to a point in our life where we are living with COVID. We have to live with this. This is here to be with us and walk within our presence for some considerable time. And in order to do that, we need to ensure that we reiterate the messaging to members of the public that this is about personal responsibility. The government can't be all and do all. If we have to have further restrictions and lockdowns, then you can appreciate the adverse impact that has on our economic stability. So we just have to continue to encourage people to adopt personal responsibility. We can't be everywhere, but if people, want to see a relatively return to normal scenario and not have COVID ramping and variants ramping and hospitals overwhelmed and more deaths and schools closed, because of course if a school is closed, and that means the parents are probably not going to be able to go to work because they're going to have to be home with the children. And then there's a knock-on impact with respect to the employment of that parent. It's, it's a continuous knock-on. So we, if everybody would just think for a moment what their actions do, and that's why we keep speaking about taking personal responsibility, because their actions have a detrimental impact on each and every one of us that live in this community.
Got you. This might be one for yourself, Dr. Oyinloye. Let me word this right. Have any cases of local transmission been recorded for this Omicron? And as well, can you provide any age range for Omicron cases? I'm hearing the schools suggest it's younger people. Yeah, any local transmission of Omicron, and what's the ages that we're looking at?
Well, so we've had a couple of situations where we've had local transmissions. There's a couple of clusters that we have found that we think is as a result of local transmission. So as of yesterday, as of the end of the 15th of December, there were 12 cases that we think may have resulted from a local transmission. With your specific question on age range, some of that is quite sensitive, so I would not be too specific around that. But there we have people from just on from under 20 to under 60 at the moment.
Let us, okay, here's one that I really was curious about. So we've had these, I get it that the travelers are coming in, they're vaccinated, so obviously we're going to be seeing positive cases in vaccinated people there. What's going on with these local cases, local transmission where it's in fully vaccinated people? I'm sure I'm not the only one who finds that confusing.
So again, this is, we are dealing with a virus that is so mutated that our protections, either from previous infection or from vaccination, isn't as good as what it is for this virus, because it's so mutated. The spike proteins has almost 30 different changes to the original virus that the vaccine was based upon. So that obviously means that the neutralizing antibodies, that's the first part of the defense, the antibodies in your blood that stops this stops you from getting infected, are less effective. But what isn't less effective and what has been demonstrated to still be very good is other parts of the immune system. So the your memory cells and your in medical jargon, the killer T cells and CD8 and CD4 cells are all intact and they're ready to respond to this. And that's why we're fairly confident that vaccinated people are less likely to end up in hospital or end up dying from this. So that's on the one hand. But as I've just expressed, the ability to neutralize this virus is less because our antibodies is not able to recognize that virus as efficiently. But if you then have a booster shot given to you, your antibody level goes up several times. Some studies claim as much as 30 times more. And the sheer volume of antibodies allows even more protection from this. So that's the physiology. On the one hand, you did mention that it appears that it's vaccinated people that seem to be getting, and that's true because
Like
it's
25%
mainly.
yesterday. Yeah.
Sorry.
Oh, sorry to interrupt, but yeah, it looked. I believe it was 95%.
Yeah, because vaccinated people are the people who are traveling the most and the ones who are exposed the most at this point in time. And we have more people who are vaccinated than those who are not. So if you look at it by absolute numbers, you will find that this is the case. What then happens, what we are trying to prevent is for this to get into the unvaccinated population because we don't know how well they'll be able to protect themselves, given that they don't have the same level of immunity that the vaccinated people have. And more importantly, certainly from my point of view, I'm very keen for this not to get to the vulnerable elderly population because that's when we start seeing hospitalizations, that's when we start seeing deaths.
Got you.
Sorry, Jonathan, this is your final question.
Okay, let's see. I'll gamble on this one. You mentioned antivirals. Is that the Pfizer pill that I've been reading about? Specifically, you know what I'm talking about. There's been reports just recently about this.
Yeah, I can never manage to pronounce the name, but I know what you're talking about. Yeah, so no, that we don't have stocks of that one yet. It's the MSK or MSD, I think, is Merck Shark and Dome pill. That's the one that came out first. Again, it's quite a bit of a mouthful to pronounce. But my medical colleagues know about this, and that's what we were in line to get.
Okay, we're getting the Pfizer pill, or?
It's just coming to the end of its phase 3 trials, and I believe, if I remember correctly, MHRA either are considering it or have recently considered it. I would need to check that up. I don't want to give you the wrong information.
All right.
Yeah.
All
Okay.
right, Jonathan, thank you very much for joining us here. Minister and Dr. Ayo, any closing remarks?
Yes, am I on? Just again, I want to just hope that everyone will just take heed to the situation that we are in. We know that the Omicron variant is highly transmissible, but we also know that we have an arsenal within our midst that can assist with respect to mitigating against that, and that's the vaccination, as well as all of the public health measures that we've been speaking about for the last 20 months.
Minister, if I may.
Yes, of course.
Yeah, I think what we've had tonight, Bermuda, is a new variant of concern that has, in a matter of days, grown to a large extent in Bermuda. While the initial information we have about this virus is that it may be less virulent, and this jury is still out on this, the sheer pace of a spread means that we could end up with numbers that are beyond what we had for Delta in the hospital. So what can we do to help ourselves? As the minister said several times, vaccination is the single most important thing you can do to help yourself to protect this. And this is particularly important at this time when we have safe and effective vaccines available on island. Please avail yourself of the opportunity if you've not been vaccinated, and if you have eligible for the boosters, please avail yourself of the opportunity of doing that. but also the public health measures that the ministers talked about several times. This is not the time to ignore it. We know we're going towards a festive period of time where everybody's together, but remember that this virus thrives on human contacts, especially when we have a lot of students and visitors coming from abroad. This is the time to prioritize your social interaction and make sure that you test before you go out and know before you go, as the minister said. If you have tested positive, or you have any symptoms suggestive of COVID, please do not go out and socialize. And please do not go and visit elderly, vulnerable people. It's going to be really, really disastrous if you have an outbreak in our most vulnerable people. So please don't do that. And if the contact tracing team has asked you to isolate or to quarantine, it's for the good of the country. It's not helpful when we get endless list of people asking for exemptions. You will not be given exemptions. So please just try and abide by those rules and let us all be safe. If you're coming into the country or you know relatives coming into the country, please remind them that they should remain in quarantine until they receive their arrival results if they're fully vaccinated. And they should not forget to take their day 4 and day 10 tests. We can do this, Bermuda. We managed to get over the Delta wave, and we can do this for this new Omicron variant. Thank you very much.
Thank you, Minister and Dr. Ayo, and thank you, Bermuda, for joining us. That is the end of the press conference, and so everyone have a great day.
Thank you.
Thank you.